Hello, everybody, and sorry that we are delayed by 9 minutes today, particularly since this is a really, really, really important topic right now, and particularly given the misinformation that we're seeing from the U.S. Department of Health and Human Services, particularly the current secretary. We're going to talk all about autism today and about public trust and about education. And I can think of no better way of doing this work than someone who is a trusted medical doctor and someone that we have worked with for years and who has been part of doing these vital town hall lessons. This is our fifth one with Dr. Vin Gupta. He has brought together for us trusted experts who address urgent health topics that affect not only our members' lives, but our kids' lives, our families' lives, topics that we've talked about thus far, like mental health, ADHD, menopause, wellness, and now autism. And the piece that is constant, other than things that are our interest of to our members, to our communities, to our families, the one core principle that we have is that truth matters. And tonight's conversation on autism and on education and public trust, this could not be more urgent. And why do I say this? Because I don't want to dodge the elephant in the room, which is Robert F. Kennedy Jr., who for decades has made false medical claims and promoted baseless conspiracy theories about autism. Now, this is the same guy who has falsely claimed that vaccines cause autism and that vaccines are problematic in any host of ways. These claims don't just spread misinformation, they undermine public health, they undermine public trust, they increase stigma, and they distract us from what really matters, which is how do we support individuals with autism? How do we support them with the dignity, the science, and the care that they need and that their families need? So, autism is not a cause for fear or for shame, it's a form of neurodiversity. But too often, families, educators, and healthcare workers themselves are left without clear guidance and support. And we've seen that throughout each and every one of these vital lessons. So, tonight, we're going to talk about with this amazing panel what autism really is and what it's not. And we're going to push back against harmful myths and disinformation. And we're going to talk about how to support children and adults with autism, how to support them in our schools, our communities, and our workplaces, and how to restore the public trust in health and education at a time when that trust is really under attack. So I am so grateful. Any of you who have been with us or have actually watched public TV during any moments of COVID know some of the people who are on this panel. You have seen Dr. Vin Gupta in so many ways trying to actually answer and navigate questions about everything about internal medicine and public health. But the other person that you've seen is Dr. Peter Hotez, who is a vaccine scientist, a public health advocate, and the father, this Dr. Hotez I didn't know until today, of an autistic daughter. He's been a leading voice in calling out so much disinformation in so many areas of health and public health and in promoting real solutions. And someone like myself who often gets attacked by people who do not want to be based in science. And then there is Danielle Hall, who is the Director of Health Equity Initiatives at the Autism Society, who brings a deep, deep understanding of how to support communities and build inclusive systems. And of course, there's Dr. Vin Gupta. So I'm going to turn it over to you, Vin, to lead this discussion. And I want to just say to Peter, to Danielle, and to you, Vin, thank you for doing this. And to everyone who is watching, thank you. And again, my apologies for starting a few minutes late.
Randy, thank you so much. As always, I know this is National Town Hall number 5, and without you at the top supporting and endorsing the importance of this series and why we're doing it in the first place, it wouldn't happen. So thank you to Randy for today and for all days. Um, uh, Dr. Hotez, Danielle, it's so great to have you here for this important conversation. There's a lot of ground we have to really cover here. And so I just, without further ado, and I think we're going to have some slides that are going to move over time. But Dr. Hotez, maybe starting with you, I just wonder if you give reactions to what you've seen over the last few months from your perspective as a clinician, as a national leader on this topic and all topics, public health, and how is this topic specifically changed over time, or has it changed?
Well, it's an important topic. The original assertions that made false claims that vaccines cause autism, it's been around 25 years. It started with the measles, mumps, rubella vaccine in 1998. That was disproven, and the paper that was submitted to the Lancet, a British biomedical journal on that topic, was retracted, and then Mr. Kennedy came on the scene in 2005 and wrote an article in Rolling Stone magazine, of all places, claiming, okay, if it's not the MMR vaccine, it must be thimerosal preservative that's doing it. And so this set up a pattern. I call it either whack-a-mole or moving the goalpost, where anti-vaccine activists would make false assertions about vaccines. The scientific community would spend a lot of time debunking it, and then they would just flip it around and come up with something else. So originally it was the measles, mumps, rubella vaccine, 1998. Then Mr. Kennedy claimed, okay, if it's not MMR, it must be thimerosal preservative. That was also subsequently debunked. And then, if you remember, a few years after that, it was spacing vaccines too close together, and that must be doing it, or overwhelming the immune system, and somehow magically that caused autism. And then it switched to aluminum in some of the vaccines. Alum, which is used as an adjuvant, also subsequently debunked. In fact, there was a very important paper summarizing that was published on Monday of this week. But I think the other, there's their link. But I think the other important piece to this is, and we can go into more depth, is the lack of plausibility. It's not just this data showing there's no link between vaccines and autism, but everything we've learned about autism over the last few decades, and a lot of it work supported by the U.S. National Institutes of Health, to a group of outstanding neuroscientists across the country, showing the genetic basis of autism, the genes involved in early fetal brain development. So the point is, this is happening before kids ever see vaccines. So this is a series of, and I have some slides if you'd like to go through it, but a series of processes in neurodevelopment. So nothing to do with vaccines, and so that, again, that lack of plausibility, and that's something that Mr. Kennedy has a lot of trouble acknowledging. He won't talk about autism genes. It doesn't mean that there's no environmental component, but it's happening in early fetal brain development, or around the time of conception in the first trimester of pregnancy. And that's important because when we talk about how to support families, how to really help parents understand autism, why there's no link with vaccines, all of those come into play.
Can I ask, just sticking with you, Dr. Hotez, for a second, why has it been so easy to to obfuscate and to confuse the public when it comes to the root causes of autism? Because I think I'm an adult pulmonologist. It would be impossible to do the same thing with, say, COPD or emphysema. We know what causes it.
That's a great
It would be
question.
hard.
Well, the part of the answer is the fact that the full clinical expression of autism often is not apparent till the second year of life. Around 19 months of age is when my daughter Rachel was diagnosed with autism. And parents, when their child is diagnosed, start to think, okay, well, gee, what happened to my kid over the last few weeks or months. And then one of the things that they remember, they'll see online, is my child got vaccinated. What's really interesting, Vin, about this, and I think this is one of the really most important parts, and it doesn't even matter if I don't get to the slides, is that the full clinical expression of autism, which often occurs around 19 months of age. I mean, it varies. There's a window period, obviously, plus or minus 6 months. And it varies depending on the type of autism, because there are different genes involved in autism. That clinical expression coincides with a big increase in brain volume expansion. And that's been worked out by serial imaging, serial magnetic resonance imaging, serial MRIs. And you can show this big increase in brain volume expansion happening at 19 months of age. But now groups at the University of North Carolina, Chapel Hill, and elsewhere have shown that that increase in brain volume expansion is actually happening since birth, but it often doesn't become clinically obvious until the second year of life. And that's important as well. So if you sort of kind of reverse engineer this and think about this, in the beginning, there's autism genes happening, operating from conception early on in pregnancy, causing significant changes in neurodevelopment. That's why the old term for autism was pervasive developmental disorder. And then that will often then set into motion after birth increases in brain volume expansion that continue throughout the first year of life. And then in the second year of life, it gets to the point where it often will cause parents to seek medical attention. But it's happening way before kids ever see vaccines. And of course, there's variation on that, but I think that's a key part of the story.
Danielle and Dr. Hotez, let's definitely bring your slides up, because I think it would help everybody. It's always helpful to just hear you riff on the root cause of autism. So please do bring those up. Danielle, while Dr. Hotez is doing that, I'm curious from your perspective. You're the Director of Health Equity Initiatives at the Autism Society. I imagine your life has gotten a lot more challenging when it comes to advocacy and making the case, but I don't want to put words in your mouth. Just wondering how the last few months have been for you.
Yeah, it's definitely been busy as far as responding to a lot of things and a lot of the rhetoric that we're hearing. We're constantly confirming autism is not an epidemic, it's a difference, and it has always existed. What's new is our ability to recognize it, especially when it's been historically overlooked. We continue to talk about vaccines do not cause autism. The myth, of course, has been thoroughly debunked, as Dr. Hotez said. And what we need to do is really focus on how we can build systems that embrace neurodiversity and they don't fear it. This rise of disinformation is really harmful, and it thrives when the trust has been broken, and it continues to revolve. So we are really looking at ways to rebuild this trust. There is no point in combating disinformation by shaming people. We want to use that trauma-informed communication strategy. So a lot of my role is training healthcare providers, community leaders, really people who are in the field, meeting people where they are, and letting them share, what are you concerned about? So if we have a father who comes in and says, I think I'm going to hold off on my vaccine for my young child because I think vaccines cause autism, we really want to not say they don't give him his shot. We want to talk about, what does trust look for you and where are you getting your information, and tell me what you are concerned about. We want to respect autonomy, but also offer that accurate and accessible information that's going to meet people where they are. So something else that we're providing, and we have links to share with everyone, we launched the Vaccine Education Initiative in response to COVID. And we've created a lot of accessible information and resources, from visual schedules and communication boards and social stories, to make sure that everyone has that voice and everyone is understanding, is being part of that conversation. And that's really important. And I know for the teachers who are on this call right now, they're very familiar with the universal design. So what may help someone with high support needs, so what may help someone with autism with communication, sensory, cognitive differences, it's really going to help everyone. And we've seen that shine through with our vaccine education initiative when we're training healthcare providers in best ways to communicate, really empowering our patients on coming prepared with, we have toolkits that help, we have these resources, and how to have conversations without escalation, especially when all this disinformation becomes emotional or political in times like today.
Danielle and Dr. Hotez, I'll come back to you in just a second on root causes, but I feel like two things are happening. And they're disconnected, obviously, but it's not limited to autism. It's, well, gosh, we vaccinate our kids against more diseases now. That's one sort of declarative statement. And oh, by the way, autism rates are increasing. And I say this as a clinician, but not an expert in the space the way all of you are. And it's being equated just in a very basic, elementary way that these two things are happening, therefore they're somehow related. I'm wondering, it feels like introducing any nuance to explain away why we're seeing increased diagnoses of autism?
Yep.
Has thought amongst those that believe the link, it doesn't seem like that's working. I'm just wondering what your thoughts are on that.
So we try to explain. Oh, I'm sorry. Go ahead, Dr. Hotez.
No. Well, I mean, when I was a pediatric house officer, well, you know what? I have slides and I actually addressed that. So maybe let me just go quickly through that, and then that'll kind of set the stage.
Sure, and that's fine. And then Danielle would love to.
That might make it easier. So just a word, and I'll just try to talk for 10 minutes. Just a word. I'm a physician scientist, a pediatrician scientist trained in New York, and always wanted to make low-cost vaccines for the world, which we've done. Our low-cost COVID vaccine reached 100 million people in India and Indonesia. No patent, no strings attached. We make vaccines for parasitic diseases. That was what I wanted to do with my life. The unplanned part, as John Lennon says, life is what happens when you're busy making other plans, is having 4 adult kids, including Rachel. And I wrote this book, Vaccines Did Not Cause Rachel's Autism. That actually came out of a year of discussions that I had with Mr. Kennedy in 2017. And this is kind of the progression of the anti-vaccine movement, how it's changed over time. We still have the threat of vaccines causing autism, but it's, morphed into libertarian concepts of health freedom, medical freedom, and now it's globalizing. And as I mentioned, it's this kind of whack-a-mole game that, that we have, where the anti-vaccine groups make an assertion and then it's debunked and they come up with something else. I call it moving the goalpost. So it started with MMR, then thimerosal, then spacing, then alum, then it was HPV vaccine. And in the book that I wrote, that's a picture of my daughter when she was a little girl. That's Rachel now. She's an adult, lives with us. She has a verbal IQ in the 80 to 90 range, a functional IQ in the 40 range, and she works at Goodwill Industries. And really going into a deep dive, explaining the evidence showing there's no link between vaccines and autism, but also what the genes are and how they're involved in early fetal brain development. A lot of this work is being done at the Broad Institute at Harvard, MIT. This is a very important paper in Cell. 100 genes have been identified. Most of them involved in neuronal connections, and a lot of them are genes that are called neurocytoskeleton genes, and that are structural genes that allow the neurons to link with each other. We actually found Rachel's autism gene through genomic sequencing, which I think we're going to see more and more kids, so we can understand autism better from that standpoint. There now has been some extraordinary studies of brain imaging looking at the neuronal connections involved and the differences between kids and adults with autism and neurotypical kids. There's also some fantastic work at Stanford. A lot of this is supported by the Simon Foundation, using what are called brain organoids or assembloids. These are mini brains in the test tube. This is work by Sergio Pasca's lab at Stanford, and they can show that neurons with autism genes have different types of migratory patterns. So it's really much a very complete story. This may be the most important slide. which shows that between
Dr. Hotez,
yeah.
Dr. Hotez, not to interrupt you, it looks like we're getting some feedback from the audience that the slides aren't advancing on your end.
Oh, all right. Well, okay. Sorry about that.
Kelly, should we have them reshare full screen?
Yeah, if you reach it full screen, or if Dr. Hotez, if you want to email to me, I can just upload it directly so we can share it, and then we can keep the conversation going. If that
Well,
works for you.
since
Look at this,
we're so tight on time,
sharing it.
maybe we'll just leave it at that. And so the point is, we have a good understanding of the neurodevelopmental basis of autism, and then this gets to, well, why the increase, which was, you know, the question that I started the slide set with.
Yeah.
And I think there's two components to this. One is clearly, and Danielle knows this very well, that we've changed our diagnostic criteria for autism. It keeps on shifting. A big change was in the early 2000s. The American Academy of Pediatrics asked pediatricians to start doing routine autism screening, and that increased it. And of course, for access to special services, some of the diagnoses that we used to give kids with neurodevelopmental conditions were not caused autism. They had other names to it. The other big component of this is we've increasingly gotten better at diagnosing girls and women on the autism spectrum. We used to say it was 10 to 1 boys to girls. Now the current number is 3 to 1. It may get closer to parity. It's just that girls on the autism spectrum can camouflage it better. They're more verbal, and so they often get misdiagnosed, or their comorbidities such as obsessive compulsive disorder, some of the eating disorders, are what gets diagnosed, not autism. So the number of 1 to 31, which is the current one, that's about to go up again because we're getting better at diagnosing girls with autism. But the point is, overwhelmingly, it's shifting diagnostic criteria. Now, it doesn't mean that there's no environmental component, but it's happening in early fetal brain development. So for instance, if you're pregnant and not aware of it, and on an anti-seizure medication called Debunking, also known as valproic acid, that will greatly increase the likelihood your child will be born with an autism phenotype because it's interacting with the autism genes. And there are about half a dozen known chemical exposures in early pregnancy that are associated with that. And that was my frustration with Mr. Kennedy. He wouldn't acknowledge it. So it was Mr. Kennedy who had no interest in discussing the environmental components, but it's all during early fetal brain development, all during our early pregnancy. And I think we do need to pay more attention to this, but unfortunately that's not where he's headed.
I would also just
Thank you,
add to
Dr.
that. I would also add to that, there's a lot more awareness and acceptance around autism now. We do a ton of work at that, the Autism Society. So in addition to the expanded criteria that Dr. Hotez was saying, we're understanding more of what autism looks like. And we're seeing it more now in women, in people of color, and especially older individuals, adults and seniors. And that's why we also need to make sure that we don't frame autism as a childhood disease, and we're setting up those structures. So Rachel is employed and she's fortunate to have employment programs. We need to look at senior care too, because these children that are diagnosed are growing up and they're going to date and they're going to get married and they're going to have babies and they're going to become seniors at some point. So the rates are increasing, but it's also because of that awareness and expanded criteria and better understanding. And from, town halls like this where we're getting more information.
There's also now some new information that's been recently published that's quite interesting on typing it in giving the 4 different types of autism, and that might be worth a look if I can. So this is a brand new information.
Please. Please do, Dr. Hotez, go ahead, please.
Yeah, let me I'll just show this one slide. And well, first of all, in terms of the increasing autism rates, I don't know if you're seeing this. These are some of the increasing in autism rates. Again, as Danielle was saying, improved awareness. The new recommendations from the American Academy of Pediatrics started in 2006. improved diagnosis in girls and women, broader diagnostic criteria from autism to autism spectrum disorder, better access to services. And it doesn't mean that there's no environmental component, but that clearly needs to be looked at as well. But again, it's early fetal brain development. Does this slide show up? This is brand new information that was just published a week ago by a group in New York supported by the Simons Foundation, looking at the 4 major phenotypes of autism. And this is helping, this may be the next generation in terms of categorizing it, in terms of those with moderate challenges, what we used to call high functioning autism, all the way to broadly affected, what some people used to call severe autism, then those with significant social and behavioral aspects, and those with autism and developmental disabilities, mixed autism with developmental disabilities. And this is a key right here. These are the major signs and symptoms of autism listed here, and the proportion detected. And I'm not sure why they connected the lines, but it's basically you can actually go through each different category of major symptoms and signs of autism, and then find your different type in order to better understand it. And you might say, well, what's the point of doing that? Well, the reason is now they associate with different types associated with different autism genes, and it makes it easier in terms of for making prognostic predictions on how you're going to manage your child and ultimately adult, and whether there are in some cases pharmacological interventions that might be helpful.
Dr. Hotez, I think that is. Your voiceover was fantastic and clear. I think if you're open to it, just because I think some of the slide progressions weren't happening, we'd love to share some of this with the town hall afterwards. But that's really interesting. I want to make sure we're getting to some of the live Q&A. Danielle, there's a ton of questions submitted to us before, and so Danielle, there's a few things that I wanted to make sure we got your expertise on. Some just basic questions. How do you get your child tested without high costs?
Great question. I would say start with it's going to depend on the child and the age, but I would start with your school district or the earlier intervention program. I actually used to work in that at the Department of Health in Georgia. A lot of the states are going to offer some of these free evaluations through public health systems. You can also get federally qualified health centers and universities. Start with your pediatrician too.
Okay. And then I'm going to rapid fire a few questions your way here. What's the link between autism, if any, and Dr. Hotez, please, as well, and screen use in young children? Is there a link?
Anything that's proven, but I think anytime that you have screens, it's going to delay some of that developmental development overall and communication. So I don't think that there's any scientific research out there. Dr. Hotez, please let me know if you know anything else.
Well, I think, eventually the state of the art is going to be genomic sequencing, and the cost of genomic sequencing has gone so far down. There are those of us in the pediatric scientific community who feel not just autism, but basically any cause for admission to a children's hospital would warrant doing full genomic sequencing. And those kinds of things are underway at some of the big flagship children's hospitals across the country. And so I think that's going to be a big change, and that's going to help us a lot. And that's where and I'm sorry the graphic didn't show up, but that's where the 4 different types of autism come into play. It's all links back to the genetics in terms of those 4 types.
Thanks, Dr. Hotez. I do have I'm going to respond to, or I'm going to pose some of the questions to you. This one is to you, Dr. Hotez. Live question from Chelsea. Do you believe, does Dr. Hotez believe that autism is genetic? I hope so, but he's not saying that, so I'm not sure. my interpretation is genomic testing, which you just referenced, in fact, does mean that we think that there's that genetic predisposition. But Dr. Hotez, just to directly answer the question on genetic risk.
Absolutely. That's why I talked about the 100 autism genes that have been identified. More will be identified, so it very much is a genetic basis. But again, it's genes also interacting with the environment, but in early pregnancy. So it doesn't mean there's no environmental influence, but it's happening in early pregnancy. Again, that's why I mentioned the best example we have is with Depakote valproic acid exposure in early pregnancy. And, and other conditions are like that. I mean, let's look at, something like cancer, for instance, where we have cancer genes, oncogenes, but they also interact with the environment. Certain environmental exposures can also help facilitate cancer. So that's the way to think about it. Autism is a very complex interplay between the environment and genes during pregnancy. And this is why I get a bit miffed when Mr. Kennedy says, well, we're going to discover the cause of autism by September. It's ridiculous, right? It's very scientifically naive. It's like saying we're going to find the cause of cancer by September. That's not how it works. It's a complex interplay of genes during pregnancy, causing neurodevelopmental changes, interacting with the environment, again, during pregnancy.
Danielle, and this is a question posed by Charles, but to layer on to exactly what Dr. Hotez just said, did the diagnostic criteria, the DSM-5 diagnostic criteria for autism change over the last, say, 20 years? I've heard that clinicians are just more aware and are looking for it and are asking questions and intakes. But I'm wondering, two questions to you. From a clinical standpoint, are clinicians just trained to ask and screen for autism, say, spectrum symptoms more frequently than they were 20 years ago? And then this is a second question to you from Susan. For parents, what are the signs to look for when it comes to autism?
So yes, the DSM has changed, and now pediatricians are doing a screening called MCHAT, and I believe it starts at about 16 months. They do it from about 1.5 years until almost 3 years old, and they're just early screening. It doesn't mean that you have autism based on this, but it will say, should we look further into this? Now, when we're talking about children, of course, autism is a spectrum. So there's going to be a range. And as we hear, no two cases of autism are the same. But just very generally and broadly speaking, some of the common signs are, social and communication interactions. So we hear about the limited eye contact, or not responding by your name, or not pointing, limited facial expressions, and delayed speech. We hear a lot. And then as children get a little bit older, sometimes we see that repetitive behavior. So we can see, we hear of classic hand flapping and rocking and spinning, being very inflexible about routines or rituals. So almost melting down when there's some difference in a day. We hear a lot about high focused interests and intense interest on certain things. So maybe always spinning the wheel of one red car, or lining up cars is another one. Sensory differences, we see this a lot in healthcare settings too. So sensitive to the bright lights in a medical setting or loud noises, seeking out that spinning or that pressure, and different reactions to pain. So it could be high pain or very low pain. We've seen children go to the hospital with broken arms and not be in any pain whatsoever. Any type of developmental delay, I would suggest, and I am not a doctor by any chance, I'm in a room with 2 other doctors, I would say look into it, talk to someone. There's no harm in exploring a little bit more. I'm a big believer in early intervention. I think the sooner you start to close a gap, the less the gap opens up, and it's easier to catch up overall.
That's fantastic. Danielle, thank you. For our audience here, and we're going to do, as we always do for all these national town halls, we're going to do a post a town hall one-pager with all the relevant information that will arm hopefully you and your families with the key points here from Dr. Hotez and Danielle. One of which will include screening resources And so we'll make sure we distill that down as we always try to do. Danielle, I want to stick with you for a second, and then Dr. Hotez, since this is part of your family lived experience, I want to get your take as well. How can we, this is something that came in before the town hall, how can we support autistic adults transitioning into the workforce? Danielle, I was just wondering from your perch over at the Autism Society, how you approach that.
Yeah, and that's a great question, and a question we're going to see more and more as we talk about this generation growing up. We do support an employment program where we're training employers on best ways to work with autistic individuals. We go through a lot of information on, should we disclose your autism diagnosis to an employer? Is it wrong if you don't? And all these things are going to be a personal decision of what you think is best. We talk a lot about legal accommodations and what's needed and what's best. There are a lot of our affiliates across the country offer job coaching and online resources that can help, and peer groups and ways to, vocational rehab and ways to apply for jobs. IEPs can also help with this starting at the age of 14. A lot of colleges will offer transitional coaches as well. So again, these interventions are going to be key. Advocating for yourself, and that goes across the board, whether it's the healthcare setting, whether it's an employment, relationships, dating, everything. It's such a key skill to have, to be confident in your diagnosis, confident in yourself, and be able to advocate for what your needs are. So through our vaccine education initiative or any of our health equity initiatives, we make sure that autistic patients are able to bring resources that we develop or that they already have that are going to help them get through their appointment, whether it's a shot blocker to help them at a vaccine appointment, or it's a body map so they can point to what's needed, or a communication board, making sure that they have access to different AAC devices, so that there's always their voice and their personal lived experiences built into any conversation that they're having, regardless of what it is.
Yeah, I would say I absolutely agree. I think part of the problem about the narrative of autism, it's all around pediatrics, and we don't, and once they become adults, the bottom falls out in terms of support, because so much of services for autism are done through the school system, either public schools or private schools. And once they're out of the school system, things really fall off the cliff very, very quickly. And either the individuals often on their own, or the parents are often abandoned at that point and left to figure it out. And that also goes for getting medical care. Remember, the genetic basis of autism means that there are genes doing other things. For instance, with Rachel, she had once her autism gene was discovered. The technology is so powerful that you can identify other people nationally with perhaps different mutations, but the same gene. And in this case, some of them had heart issues as well. And on that basis, we referred Rachel to a cardiologist. So that's more often than not happening, because we don't do genomic sequencing. So there are a lot of physical disabilities in adults with intellectual and developmental disabilities that are not getting diagnosed. The availability of psychiatric services or mental health services, forget it. Insurance is not covering it, so it's trying to find a mental health counselor or therapist that accepts insurance is often problematic. So I believe this is a national crisis right now, in terms of how to handle adults with intellectual and developmental disabilities. And because it's not financially viable for a lot of the health systems and insurance companies, this also falls through the cracks. So this is the next big crisis that we need to address. And this is why I get frustrated with Mr. Kennedy. There's the needs for both kids and adults with intellectual disabilities are so pervasive, and yet this is what he chooses to focus on, exactly what we don't need.
Can you hear me now or no?
Yes.
Good.
Perfect.
Sorry. I did want to, Dr. Hotez, go back to that for a second, your conversation with RFK and with Rogan and with others. What do you think, and I want to get to a second question here that Chelsea asked, but what do you think is going on with him that he would have this fight with you? And then that Joe Rogan would challenge you to a conversation. And I wonder actually right now, if you had that conversation with Joe Rogan, would it be the same as a few years ago? But unpack this for us a little bit.
With Mr. Kennedy, that was done at the request of the National Institutes of Health, and because in 2017 he came out before the inauguration of President Trump in 2017. He said he was going to be appointed head of a vaccine commission. And at the request of the NIH, they asked me to talk to him because they said, look, hey, Peter, you're a vaccine scientist, a pediatrician. You're the parent of a daughter with autism. You can explain this to Bobby, as they said. And we had a year of discussions that was mediated by a third party individual, and they just didn't go anywhere. He was deeply dug in, very conspiratorial, and all he cared about was, confirmation bias that is something to do with vaccines. The most frustrating part was when I would talk about the environmental factors in early pregnancy. I would say, Bobby, you're an environmental attorney. You should be all over this. I mean, I've identified half a dozen chemical exposures in early pregnancy interacting with autism genes. This is your moment, man. This is where you should begin the focus on, because there's probably many more that, and I couldn't engage him because he was so fixed on vaccines. And so that was a source of frustration. With Rogan and Elon Musk and all that nonsense in 2023 to debate him, since I'd already spoken to Bobby for a year, I didn't see the point in having a public discussion with him. He had no interest in the science, so I didn't think he had changed at that point. I also thought it sent the wrong message especially for young scientists, about how we do science. I can't think of a time when science was advanced through public debate, especially with someone who has no scientific knowledge. That we have a way of doing science through peer review of scientific papers and through review of our grant applications and presenting at scientific meeting with colleagues, to debate with someone with fixed belief who kind of makes it up as he goes along. I mean, I didn't see the productivity in that, and basically they just wanted. I felt that at that point they just wanted me to help legitimize him as a serious presidential candidate when he was running for president at that time. And I remember Molly Jong-Fast, also who spent a lot on MSNBC, basically saying that, and it kind of resonated with me that that was kind of used for political reasons.
Well, it leads me to just promoting the new book that you just wrote that is out on September 9th, right? Did I get that right? Which is Science Under Siege.
That's right. That's right.
Which, as we were talking, I went to and I bought it online digitally. Which also leads me to actually say that I also wrote a book that's going to be out on September 16th, which is called Why Fascists Fear Teachers. And a lot of it is because of, thank you for all those hearts, a lot of it is because of the misinformation and the disinformation that we're all trying to debunk, and what school teachers do, and it kind of goes full circle here. What educators
I think this is the common denominator for all of us, for Dr. Gupta and for Danielle as well. I mean, we spent a lot of time debunking disinformation, and unfortunately, it's pervasive. And Vin, you do a wonderful job doing that on NBC. I learn a lot from you, and in how you do this. This book, Science Under Siege, is co-written with, you see in the picture, with Michael Mann, who's a climate scientist who for years has gotten beat up like I get beat up for defending vaccines. And we compare the attacks on biomedical science with attacks on climate science. And there are some differences, but there's a surprising amount of overlap between the drivers of this. And so it's we try to carve some light through the darkness, but it was not an easy book to write.
Well, it leads me to, let me do one more question, Vin, and then I'm going back to you.
Please.
Because I think that what you said before about making sure that we get everybody who's on the slides and making sure we put it up on Share My Lesson. So let me ask, and then I'm going to answer the question about, can we talk about the Federal Department of Education being shut down and how it will impact autistic students. Let me answer that in a minute. But let me just say to all of you, so what happens tomorrow before people get the slides and they're like, oh, I thought I should have listened a little bit, like, what do I do if my child is manifesting a symptom that I learned about today? Or what do I do if a kid in my classroom is manifesting a symptom but nobody has been diagnosed? What do I do? Where do I go? So what if there was one place that we could tell people to go right now before our slides are up, what would that be to Dr. Hotez, Dr. Gupta, or Danielle?
Well, I'll defer to Danielle because, one of the things that's changed since my daughter was diagnosed back in the early 1990s till today is most school systems have become a lot more sophisticated and knowledgeable about autism and in terms of how to do the referral system is probably it's a lot more advanced from what my wife and I had to deal with almost 30 years ago.
Yeah, I agree. I think there are, so many more resources. Now, what that's going to look like if we lose federal funding, that's a whole other conversation to be had.
Right. Which leads me to the last question I'm going to answer, which is essentially, Linda McMahon has been given the role of dismantling the Department of Education. And what we have tried to do is to say that dismantlement, that ending of it, that also comes with effectively ending the funding. And there's not enough, but there is significant funding that goes for the IDEA, Individuals with Disabilities in Education Act. There's a significant amount of funding that goes for research. And a lot of this, a lot of information, accurate information, comes from the Department of Education, at least the one that was there before January 20th, 2025. So if we lose the information and we lose the resources, that's going to be a problem. And the second really will be a problem is if this gets all transferred to the Department of Health and Human Services, where Kennedy would then be in complete charge of all of the funding as well as all of the information conduits. So the AFT is fighting both. It's fighting the transfer of monies and resources and information around IDEA to the Department of Health and Human Services, and we're also fighting against the cut in funding. And we're doing it in as many different ways as we possibly can do it, including the fact that Congress is actually the one who's supposed to be making both of these decisions. IDEA specifically, under law, is supposed to be governed by the Department of Education. So we've gone to court in many ways. We just lost the injunction in front of the Supreme Court just this week, but we will keep on going to court and ultimately, and these are not political events, these are education and events, but ultimately, if the people in Congress right now won't follow the law or won't actually work in the best interest of children, then we'll work against those people and try to get other people into these positions. That's what we're going to do, Chelsea, and that's what we've been doing in terms of this fight.
I'm also concerned about Mr. Kennedy's looking to create this registry of people on the autism spectrum,
Yeah.
and particularly because he talks about it in such dark terms, right? You know, he says they can't use the bathroom and they can't, they'll never be taxpayers, they'll never work. And that just, doesn't describe the majority of people on the autism spectrum. My daughter, Rachel, she has intellectual disabilities, but she works at Goodwill. She gets a paycheck. She's proud of the paycheck. She pays taxes and she's proud of that. What does he want to do with this registry when he won't even say that there are autism genes involved, and he talks about in such dark terms and uses a lot of Holocaust imagery. I'm very concerned what he has in mind. He's certainly not following the science.
Dr. Hotez, Danielle, there's almost too many questions to get to, and I know it's late on the East Coast. Dr. Hotez, I do want to be responsive to all the great Q&A. There's too many to get to, and we're already at time. Maybe in 30 seconds each, if you could just give us quick hits, and then we'll wrap. This is relevant to everything that you just mentioned. Are there, when you suggest that there are both environmental and genetic factors when the fetus is developing, is there any way the mom can help prevent or make the autism less severe? I think actionable steps, recognizing there's certain things people can and cannot control. Anything you would recommend there? Or how would you speak about prevention given multimodal risks?
Well, I think in terms of understanding the environmental exposures, there's only a handful of known ones right now. And with Depakote, valproic acid being the best known one. And this is why, we need support from the National Institutes of Health to really expand that list. So no, there's not a lot you can do other than the fact that be cognizant that there is a genetic basis of it. So if there is forms of autism in your family, then be aware of it. But the pattern of inheritance is often very complicated, and so it may not necessarily be very instructive for you.
Great. Danielle, I'm going to give you last word here. We're getting questions about leukavorin. We're getting tons of questions that were submitted about just should you disclose your autism diagnosis to your employer? Maybe as you wrap, if you could give us just kind of how you approach or how the Autism Society sort of your point of view on that, just transparency, kind of seeking support services, especially into adulthood.
Yeah, I guess I would say, listen, it's a personal choice. You do what is important to you and how you feel. I'm not going to tell someone to disclose and someone else not to disclose. It's what you need and what you want. But what I will focus on is that inclusion. And inclusion is important for every place that you are, whether it's a medical setting or a school setting. So inclusion doesn't mean just being allowed in the room. It means being supported and respected and valued when you're there. So I'd like to just end with that, advocate for that training if you need training. If someone says a system doesn't work for them, believe them and work to make it better. And inclusion is going to be at the foundation of that.
Thank you both. Randy, I see that. I'll kick it over to you for any last thoughts.
So I think, just like Vin, all the others that we've done, half of what we're doing is busting myths, and half of what we're doing is making sure that we create a funnel. We create a space for people to be able to ask questions on issues that are sometimes hidden. And so I can't thank Danielle and Dr. Hotez enough for, being so open and out there today about, one's own, about Rachel, Dr. Hotez, Danielle, about all the work that you've done. But, you know, what's happening here is we are really trying to make sure that people have a sense about what to do, how to recognize symptoms, how to debunk myths, and most importantly, how to help, whether they're our own children or grandchildren, or whether they're the kids we serve in schools, how to help kids have their best lives. And so I just really want to say thank you to you, Vin. Thank you to you, Dr. Hotez, to you, Danielle Hall, for this really, really, really important, um, um, uh, town hall tonight about autism and how we make sure we support any of and all, not only kids but adults who are on the autistic spectrum. Thank you very, very, very much, everybody, and have a good few weeks. And we will be back in August.
Thank you, Randy. Thank you, Vin. Thank you, Danielle.
Thank you.
Thanks.
Thank you. Thanks, everybody.